Good day, everyone. Okay, here we are. Good day, good night, good morning, wherever you are. My name is Gordon Tapper. I'm a former section chief at the United Nations, founder of an NGO, Give Them a Hand Foundation, now chairman of the United African Congress, and we are one of the sponsoring organizations along with the International Association of Applied Psychology and the Black Star News. Let me welcome your viewers and listeners from around the world who are our guests today on this important webinar on the topic of coronavirus in Africa. As you probably know by now, the coronavirus has taken a deadly toll all around the world. As of midnight on May 14th, the global statistics are 4.3 million infected, 293,527 deaths. In the United States alone, it's 1.3 million infections and 82,000 deaths. In Africa, which is the focus of our attention today, we have another story. I will ask for the statistics, the slides to be put up on the screen for us to see. Anyway, Africa, a continent of 1.3 million persons and 54 independent nations, has a combined total of 69,947 cases and 2,410 deaths. That's less than we have here in New York State, where I live, which has 185,000 cases and 15,233 deaths. The countries in Africa with the most infections and deaths should be on the screen. They're not up as yet. Unfortunately, the Rainbow Nation of South Africa has the highest total of infections, followed by Egypt, Morocco, Algeria, Ghana, and Nigeria. At the far end of the scale is Lesotho. Lesotho had its first recorded infection yesterday. Overall, where Africa is concerned, is this good news or is it bad news? That is the number of infections and deaths. What does the immediate future hold? What does the long-term future hold? Well, we have 4 speakers on our program today who will tell us exactly what is taking place in their countries at the moment. They're all journalists reporting from within the eye of the storm. There first, Mr. Ralph Mathekga, a political analyst and journalist from South Africa. He has written pieces in the UK Guardian, the New York Times, and many major news outlets. I put him in the category of fearless journalist. He is from News 24 South Africa. If you look on the screen, you will see one of his quotes that he made a few days ago, which I think is really very important. It says, "One thing observable since the outbreak of the COVID-19 pandemic is that this virus is impossible to spin. All leaders who sought to miscommunicate this virus are already on the wrong side of history." And that's what Ralph said in his piece a few days ago. I reminded him of it, and he didn't realize the impact it made, but it has made some impact. Next up, we have Mr. Billy Entaote. He's from the Kingdom of Lesotho. His platform is the Center for Investigative Journalism in Lesotho. It will be interesting to hear from him exactly how Lesotho manages to report such figures, such encouraging figures at this particular time. Then next up, we have a young lady from Abuja, Nigeria. She's a journalist who is the editor and associate chief correspondent for Nigeria, the news agency of Nigeria. I read her piece yesterday, and on International Nurses Day, as she recognized those courageous and selfless warriors on the front line. In many instances, it seems that they're battling dragons with their bare hands, without the necessary ammunition and weapons to make it a fair fight. Last but certainly not least, we have a highly respected journalist from Ghana, TV3, Mr. Komla Klutse. He too fits the category of fearless journalists. Well, we are just about ready to get these speakers up, but before I call on them, I must tell you what the program holds for us. We will start with the journalists reporting from on the ground, and that will be followed by a question and answer session with our resident panel of experts. And lastly, we will take questions from you, the participants, that you submit in the chat box. And with that, I will kick off the program by welcoming Mr. Ralph Mathekga to the stage. Mr. Mathekga, it's all yours.
Thank you so much, Gordon,
Welcome.
and it's a pleasure to be talking in this forum. Am I clear?
Yes, we can hear you. Please go ahead.
Yes. Yeah. If I can go ahead.
Yes, please. Please do.
Yes. The situation in South Africa regarding the COVID-19, I would say it has found us at a very weaker state in South Africa. Weaker state in a sense that our economy was already experiencing challenges. We were already sitting in the range of about 26-27% of high unemployment, affecting the young Black youth, highly concentrated among the young Black youth. And this results in socioeconomic conditions that are very dire where people live. We know about the struggle that we see in urban areas in South Africa that we all see. So when the COVID-19 hit us, actually, it actually showed us that you know, we have wasted a lot of time in past. We should have attended to some of those issues because it actually exposed us that we were not even in a position where one can say we can sustain some of the regulations that were undertaken by government when it comes to the hard lockdown. I want to believe that we are one of the countries globally that has quite a very tough lockdown. As I speak to you, we are on about day, I think it's day 48 or so, day 40s of the hard lockdown. We even have a curfew from 7 p.m. until the next day 5. And the difficulty that we have seen so far is that having to enforce the lockdown in various areas, in rural areas, in the township and so forth, it has laid bare the challenges of our socioeconomic, the socioeconomic challenges that we have. I mean, we know all this problem, but it became very apparent to us. It was just right there in front of our eyes that some of the people cannot sustain a total social distancing in areas where they live. For example, some live in the tin houses and so forth. And if you look at the level of food desperation, majority of those people are used to going around to fend for themselves. And now they have to depend solely on the state during this time. They cannot go out. They don't have any savings to last for about a week. So those issues are the issues that came out very much in the open as we undertook this lockdown, almost threatening to create a catastrophe of its own, a humanitarian crisis. I mean, when we talk about the possibility of a humanitarian crisis coming out of the socioeconomic spillover of this, we will not be exaggerating. You have seen the queues in South Africa outside where government has responded by trying to increase social security, give grants and so forth. But you look at the desperation at which people are going there, you realize that you end up with even crowds outside. And I think what has placed government much under pressure is that you cannot actually enforce a socioeconomic challenge through security. You cannot securitize a socioeconomic challenge. When people fail to strictly adhere to some measures of the lockdown in the township, because socioeconomically they cannot, they don't have decent houses, they don't have food, they don't have other ways of pastime inside their yards and so forth. And you have also overcrowding and so forth. When people are finding it difficult and you tend to unleash the security forces on the street, the whole thing becomes very unpopular, where as government, you start losing legitimacy. And my view is that far at the beginning, in South Africa, government had a great deal of legitimacy in the first week. People were rallying behind. I listened to radio day in, day out. There were no sharp criticism of government. But as government went back to having to manage the day-to-day existence of people under the lockdown, police them, respect their human rights and so forth, then problems started to emerge. We started to see problems of human rights abuse on the street. People started questioning the measures to say why some of the measures seems to be just strict for their own sake. What is the rational connection and so forth? And what I think is happening is that legitimacy gradually erasing on the side of government, and it can only be actually reinstated by consultation and government de-escalating its security, I would say, approach to this and pushing more of a social compact or a social cohesion or some kind of a consultative approach where government can actually march with the people. So it is where we are now, where we are at level 4 across the country. Level 4, I mean, it is a very strict level where we still have the curfew. You go out for essentials. There are only designated goods that you can buy from the shops and so forth. Even if there are so many questions that have come out, no doubt, the president has said that we will most likely go to level 3. I think also other social stakeholders in the country, the lawyers, the NGOs, they are asking questions, and we are at the stage where people are beginning to say that, look, we are going to question some of the constitutional basis of this decision. The National Command Council, does it have the constitutional basis to make this decision? This is not because people, I think, do not understand the urgency. I think it is the irritation with the exercise of executive power, which I think it is a global phenomenon. Some of you have seen the case in Wisconsin, in the US, where people successfully, for whatever different reason, they successfully challenged lockdown measures in court. And I think in South Africa, there will be such kind of attempt unless government de-escalate, talk to people, and instill a sense of common ownership out of this. That's in a nutshell how it looks on the ground in South Africa. Mixed, of course. The spread is still increasing under the lockdown. Government is saying that it is better given the projected increase that they thought would come out. But again, we are still struggling in getting information from government timelessly. You look within the media, people are saying, give us the data, give us more information, give us the idea about the model that you are using so that we can be on the same page.
Wonderful. Thank you very much, Ralph.
Thank you.
There's a lot that seems to have changed. I remember speaking about 3 weeks ago with you and some other folks who were very happy, who thought that the government was on the right track. But obviously, as things have, should I say, escalated, things have changed a bit. I know we will have questions for you in the Q&A section of this, and I'm looking forward to that. Okay? Thank you so very much, Ralph. We would have Billy Entaote with us, but he's not yet. He's having some technical difficulties. So I am going to move on to Cecilia. And she is from Nigeria, from Abuja, actually, and from Nigeria Network News. Cecilia, are you ready? Can you unmute her, please? Yes.
Oh, that's fine.
Welcome, Cecilia.
Okay, thank you very much. Good day, everyone. It is a privilege to share my experience with you as a journalist covering COVID-19 in Nigeria. I would like to divide my presentation into 3 parts before I go to the impact. They will take you through the situation before COVID-19, then what has government been doing to curb the spread and the impacts of the lockdown in the country. But by way of introduction, Nigeria has 36 states with federal capital territory and a population of over 200 million. Nigeria recorded its first case on 27th of February, and since then, the virus has spread to 34 states with over 4,917 confirmed cases reported as at May 13. So what was the situation like before the pandemic? we saw a situation of poor health infrastructure. Although despite the challenge that health professionals face in Nigeria, they've been able to handle epidemics using facilities available as they are currently doing for Ebola, for Lassa fever, and they did for Ebola. So at this movement too, Nigeria did not have testing capacity, but discussion was on ground with WHO to use the 5 special infectious laboratories for testing. So also there were also lots of myths that COVID-19 could not thrive in African blood. So most people did not believe that coronavirus will even ever get to Nigeria. So now that the virus is in Nigeria, what has the government been doing to curb the spread? The federal government has been sensitizing the citizens by holding press briefing and doing jingles in the electronic media on a daily basis. Also, the Nigeria Center for Disease Control send SMS to Nigerians 3 times in a day, in a week, to give them information on what is expected of them. So since then, the government has increased the testing capacity from 5 to 25 laboratories. Also, as the cases began to rise, the federal government placed a lockdown for almost 35 days, which started from March 30th to May 3rd. And after in which there was a lift, the federal government lifted a ban on the lockdown, citing economic hardship. But what the situation we have now is that the country is going through a period of partial lockdown. The federal government has eased the lockdown, and with that, for another 2 weeks, there are still bans on religious activities, social gathering. Schools are still closed. So what has been the impact of lockdown in the country? First, the lockdown has impacted heavily on the economy. Nigeria depends on exports of crude oil as a source of primary revenue. The collapse in global oil price caused by COVID-19 has also affected the revenue base of the country. As a result of that, the government cannot meet its revenue targets, and by implication cannot meet its expenditure. For instance, the federal government had based its 2020 budget on a price of $37 per barrel, and oil has collapsed below $30 per barrel. So as at yesterday, the Federal Executive Council met and reviewed the benchmark to $25, which was $57 before. So secondly, then talking about the social impact, as a result of low revenue, government cannot provide enough stimulus and palliatives for the citizens whose source of livelihood has been affected by the lockdown. Of course, this will further lead to high poverty rates in the country. In a recent statistics released by the National Bureau of Statistics, the poverty, the Nigerian level, the 40% of Nigerians live below poverty line. That means more than 82 million of Nigerians live less than $1 a day. And with the lockdown now, the source of livelihood of over close to half of the population of Nigerians have been affected. So also, thirdly, education. The lockdown exposed poor education infrastructure in the country. Our students are apt to adopt virtual learning during the period. Before now, very few schools had been using online facilities to teach. So what we have now is we see a wide gap in learning between the students from rural areas and urban areas. Also, the issue of technology to go online. How many students can afford to get these gadgets we are talking about? Even though if they have the gadgets, Can they also enjoy smooth learning because of poor electricity? So also, sexual and gender-based violence. According to media reports, there's rising cases of sexual and gender-based violence against women and girls in different parts of the country. Women and girls are being raped and abused on a daily basis. There's a video that on social media that went viral about a woman who ran out of the house because her husband was demanding for sex after they've been together from morning to evening. In the evening time, she ran and I said no, she was tired. So we see such cases during this lockdown. Also, the crime is on increase in some parts of the country. I have a personal experience on 7th of April. There was an attempt to burgle my apartment. So we see cases of crimes because people are to take to crime now during this period. We also see that they also see the impact of the lockdown on religious and social gathering. The lockdown has really impacted on the social and religious lives of the people. Traditionally, Nigerians like living together and celebrating. Now, with practicing of physical distancing and the rest, has caused people to stay apart and also hinder their fundamental right to worship well. So what the churches are doing now is to also use technology to meet, for prayer meetings, Bible studies, and the rest. So we see that the lockdown has really impacted greatly on almost every aspect of the economy and even the human endeavors. So in conclusion, as Nigerians wait for further directive on whether the federal government will lift ban on the partial lockdown or not, the lockdown will continue to impact on the economy of the country and source of livelihood of almost half of the population. The question is, will Nigeria ever remain the same after the pandemic? Thank you.
Thank you very much, Cecilia. Clearly, you have your finger on the pulse of the nation. The numbers in Nigeria have crept up worryingly. Lagos is a city of 26 million persons with immense challenges. We hope to flesh that out and learn more about how the millions of people who live in the, what shall I call, or what is described by writers as slums. How are they surviving? How are they existing? And in that area where the density of population is amongst the highest in Africa and amongst the highest in the world. So perhaps we will be able to address that in the question and answer section. Our last speaker is Mr. Komla, Klutse, producer and senior broadcast journalist with TV3 Network in Accra, Ghana. And I would like to invite him to make his presentation. Komla.
All right. Many thanks to you, Gordon. And late evening here in Ghana. It's almost 4:30 p.m. and I must say that I'm grateful to you guys for giving me the opportunity to be part of this conference. I must say that since March 12 that Ghana recorded its 2 cases, the numbers have soared to 5,408 with 24 deaths and 514 recoveries as I speak at the moment. Ghana has so far carried out well over 140,000 tests with calls for mass testing of the population. In fact, what Ghana was doing from the onset when the whole fight started was to go ahead of the virus. By so doing, they identify if anybody has signs or symptoms of the virus, they go ahead and test. And then when you test positive, they do contact tracing. And the contact that they have to trace would go as far as to many people who do not even know that they have the virus. But once you are able to be tested and then they identify that this is the problem, then you would be isolated or be allowed to go into self-quarantine. Now, the country went into a 3 weeks lockdown with an executive instrument on the imposition of restrictions. There's still a ban on social gatherings such as schools, political activities, funerals, parties. The lockdown, I must say, has been subsequently lifted. The government during the period of the lockdown shared food to vulnerable people, that is 400,000 people a day, to the tune of 2 million cedis. This figure, I must say, however, has been largely challenged by the main opposition party and other civil society organizations, because government at a point in time, some government appointees did say that the government was spending 2 million cedis a day on feeding the vulnerable groups like the KIAs and the others. However, when journalists pushed government to substantiate, they came further to say that, well, the figures may not necessarily be what it is, but they failed, however, to state how many people you were feeding with 2 million cedis though. That number is yet to be put out, because they say, well, when everything is said and done, Parliament, which is on recess, when they come back, the government will be accounting to the legislature, that is the Parliament of the Republic of Ghana. Now, the Parliament of Ghana, however, did approve some $1.4 billion for dollars for the government of Ghana to spend for the fight against this, aside monies the government got from the IMF and then the World Bank. Now, the major challenge, I must say, for the country now, apart from the figures, is the issue of social distancing, the use of face masks, washing of the hands with soap and the running water, and the use of hand sanitizers. Markets are open, but it is increasingly becoming difficult to see a real social distancing. Also, the use of the face mask, despite insistence on the usage of it, it's still one of the problems that the country is dealing with. Just this morning, the usual or the routine press briefing that the government gives us, the Minister of Health was quite angry at the fact that people are not taking the protocols into usage, and he says that, well, the government has done its own. They have locked the entry point into the country, both land and sea, and then air. But what is left?
Okay.
Can you hear me?
Yeah, you can text me the name.
Can you hear me? Can you guys hear me? Okay, so I'm going to go on. So the government has locked down the various entry points. However, they said that, well, this is what we can do for you as a government of the Republic of Ghana. It beholds on you to keep your personal hygiene. That is, you have to maintain the use of the hand sanitizers, wash your hands, use a face mask, and then also ensure social distancing. In fact, what the government is trying to do now is to come up with a policy directive that has to do with ensuring that there's some level of social distancing at work. In fact, the Minister of Health says that they are going to go forward to see how best they'll be able to put a blueprint together that would ensure that not just government workers, but even the private sector will adhere to these things. Now, let me state that all of these have had some level of criticism, especially from the main opposition parties, though. Now, I mean, if the government, the president did announce that he's going to be building over 90 new health facilities, the opposition, that is the NDC, that was in government before this new one, built some health facilities. Now, when they built that, one of the major things they've said is that the government has not put to use those facilities. If the government has not put to use the facilities, they say, why then do you go ahead to build 90 new ones when the ones they built before they left office, you've not put them to use? Now, they talk about huge facilities across the country that they think that the government must be serious to do. Now, the president in questioning of the citizens did announce that there would be 3 months of non-payment of water bills. That has started. The implementation of that has started. Now, also, there was a 50% cut on electricity bills that also started from just this month. So from the month of May, June to July, citizens are going to be paying just 50% of their total electricity consumption. Now, I must say that one of the controversies the country has had to face is with the issue of peaking. Health experts who are advising government did say that the country is beginning to see peaking of the cases. And I know from the other countries, from South Africa and Nigeria and the others, I'm sure this is one of the debates that's going on. If you say that you are peaking, what it means is that you are getting to the climax. And the moment you begin to downtrend or to dip, then it means that there's some level of success. But if government or the health experts who are advising government are saying that you're hitting a peak, why are the cases going up? In fact, this has been largely challenged by CSOs and other health experts who say, no, you cannot say that because it cannot be true that we are reaching its peak. When your numbers are going up over 5,000 cases, why do you say that you're reaching your peak? So this is what it is. Now, I must also say that with the coronavirus, the economy of Ghana has been largely hit. But just yesterday, before the lockdown, the president said he was lifting the lockdown because of the data and science available to him. But yesterday, the Minister of Finance, and this was what he said purely. He said because of the data and science, he was lifting the lockdown. But just today, just yesterday, the Minister of Finance for the first time did make the confession that, yes, indeed, Ghana's economy could not support the lockdown, the reason why they lifted it. And this has been largely discussed among major news outlets in the country, both radio, TV, and online, that the government was not truthful to the people then. If you're saying that it was data and science, what sort of data and science are you talking about? With respect to this, as the economy has been largely affected, now inflation, for the first time in several months, has risen from 7.8% to 10.6%, which, I mean, it has been one of the talks when it comes to political jabs between the governing party and then the opposition, the issue of inflation, inflationary politics. But the defense to this from the government is the fact that COVID has been of one distressing circumstance to the economy of the country, and that they think that, well, we've got to bear the responsibilities of this and then readjust. Now, prior to this, government was making some revenue. Now the revenue is no longer coming. So, I mean, some of the tax waivers and things that they're giving to the citizenry, most especially at the port, that is no longer being done. Largely, I must say, the issue of COVID-19 has had a toll on especially government because, I mean, major revenue is not coming. Then businesses, some businesses are still home now. People are working because, well, they feel that they're still not safe. Schools remain shut. Students cannot go back to school. But if you consider the tertiary institutions, indication I picked up a short while ago is that some of the tertiary institutions are beginning to set exams online. For instance, the Zoom that we are using now, they're going to be using that to be writing exams and all that. That's the new way of life Ghanaians have had to adapt to as the coronavirus continues to bar its teeth to the citizenry of Ghana.
Well, thank you so very much, Komla. Indeed, conquering COVID-19 will require a sensible and a determined approach by the government and the population that is willing to play its part and able to play its part. However, as you pointed out, the choice of going out to earn an income and the need for social distancing may very well be objectives out of step with each other. We will have to see how that works out. You are another in the category of what I consider a fearless journalist, totally unafraid to challenge the power structure in your country. And I think your presentation has been absolutely marvelous. With that, I am going to embark on the other part of the program now, which is a question and answer. You will be, you three speakers, you three journalists will engage in a dialogue with our panelists of experts. And I will tell you who we have as the panel of experts. They're Dr. Mohammed Nur Hussein, Chairman of the United African Congress, Professor of Medicine Emeritus, and former Chief of Geriatrics at State University of New York, Downstate Medical Center. He is Ethiopian by birth, and the range of knowledge he possesses in a multitude of areas is very impressive. He could even give a lecture on the history of jazz in the United States, jazz and blues, actually. He amazed me on a mission that we went to Jamaica, a medical mission, where he knew every blues guitarist and every jazz musician that has ever lived in the United States and around the world. Next is Dr. Judy Kuryansky, United Nations representative of the International Association of Applied Psychology, professor in the Department of Clinical Psychology at Columbia University's Teachers College, a trustee of the United African Congress, and the psychosocial first responder and trainer in many infectious diseases, epidemics, and natural disasters. Then we have Mr. Milton Alimadi, a Ugandan by birth, adjunct professor of African history at John Jay College, a Pan-Africanist, human rights activist, and publisher of the Black Star News. And before I begin this, I want to say that a very close friend, a very good friend of the United African Congress, a very close friend of the panelists and many of us who are here, the ambassador of Sierra Leone to the United States of America, has just sent me a text message. And he said to me, Gordon, you said the population of Africa is 1.3 million. Please correct it. It's 1.3 billion. So I stand corrected, Ambassador Y, and I stand corrected, everyone. Then he also had another correction. He said, you mistakenly referred to yourself as chairman of the United African Congress. You are the president of the United African Congress. Dr. Nur Hussein is the chairman of the United African Congress. We can't have two chairmen. So thank you very much, Ambassador Y. I'm so sorry that you're not on the program today, for I know you would have wanted to tell us what's going on in Sierra Leone. And as we have collaborated with you on other occasions regarding COVID-19 in Sierra Leone, and we know that you're very active in this direction. And if you decide that you would like to say something, text me and we will put you on. Okay? All right, and with that, I will ask the panelists and the speakers to get started. And in this session, we will have one panelist that will pose a question. It can be directed to a particular journalist, and or it may be, if there are others who wish to chime in and respond, they may do so. Then that goes to the next panelist will ask the question, and then the other panelist, and we will go in a circle until what should I say, until we have completed the round of questioning. We will allow for follow-up questions, and we want the questions also, we want you to answer thoroughly, but we also want it to be quite concise in your response and not take too much time so that we can get through a lot of questions. And who will we be starting with? Dr. Nur Hussein, do you have your questions that you're ready to pose? We will let you go first, then we will let Dr. Judy, and then we let Milton Alimadi go next.
Yes. First of all, thank you, Ralph and Cecilia and Komla for the really comprehensive overview of the situation in your respective countries. What you described is similar in many ways, applicable to almost every other country in Africa. That is the dilemma these countries have between the need of the public health requirements and also simply economic survival. I just want to ask Ralph regarding the situation there. You described kind of bleak situation in terms of the economy. It was at the time of the dismantling of apartheid, we had, all of us, not only South Africans, we were all euphoric, and the government was committed to really improving the condition of the vast majority of the population, addressing human needs. And it seemed that it was doing that the first few years of the post-apartheid era. What happened after that? Did the ANC lose its way? Has it become sclerotic or something? What exactly is happening that this not continue?
I think that it is indeed a correct reading that in the first decade or so, the first 5 or so years of our democracy post 1994, government has actually done a lot. I mean, they can point to the number of housings that have been built. They often say that we might come out as a country that has built the highest number of housing for people within a short space of time. But also, the challenge is that the legacy of apartheid in South Africa was very deep. I mean, it is reflected in terms of the education, in terms of access to opportunities, that even if you can build houses, you try to build those houses, you still need to be able to change the structure of the economy in a way that it allows majority of Black people to begin to share into that. And that is what we have actually inherited. So you can focus, and I think there has been that focus, Doctor, for in the first decade or so, where you can say service delivery was accelerated. A lot has been achieved, early childhood education and so forth. But I think that what people tend to call the sins of incumbency started causing problem for the governing party. That is the ANC you are talking about. And the biggest threat has actually to the ANC has not been the imperialists who want to steal the policy and so forth. No, it has been internal problems within the party, corruption within the ranks of their own party. Remember, before we got into this COVID-19, we were hosting one of the biggest commission into corruption, into state capture. I mean, we might count as the first nation in recent time to stop and say, let us ask who's actually exercising power in our politics. So it shows the level of decay that actually sidetracked government from facilitating service delivery project. And unfortunately, it is the very same government that find itself now where it is lethargic, corruption is endemic, we are losing a lot of money to corruption, state-owned entities that sometimes provide us with electricity and so forth, some have been hollowed out because of corruption. And at this point, unfortunately, the COVID-19 does not need a state that lacks capacity. So we were not prepared. So we have to now deal with our historical problems of capacity that have been caused by corruption and step up to this mammoth challenge. That is why even if government tries, where you can see that they're doing their best, they try by all means, question always linger. It is always because of outstanding problems that are compounding now in revealing that challenge of the socio-economic map that we have. And I think we've got a great deal of rebuilding to do after this COVID-19. We have to think about how do we reground the society as South Africans. If we miss this opportunity, I don't think we will get another crisis in 100 years.
Thank you.
Any follow-up or anyone else? Okay, so we will move to Dr. You were saying?
Yes. Well, basically, I think the situation is similar in so many ways in all these countries. The problem is that enforcing for example, social distancing, as our colleague Dr. Judy Kuriansky wants to call it, physical distancing. We really, but for the physical distancing and also the lockdown, particularly in a situation where so many people's livelihood depends on getting out there and making their the daily earnings is what their next bread is, basically. And so if there is no government capacity to provide the food and other necessities after locking them down, what are they supposed to do? You know, so it's either dying of hunger, as someone said, or dying of the disease. Most likely from hunger first. You know, so that's what's happening. And I don't know if the resources of the country are properly prioritized. That may be the issue in both in South Africa also and in Ghana and Nigeria, as we heard earlier. Yeah, what do you say about, and this is for all of you, each one of you, that the government has its priorities right? And of course, there is a lack of transparency and accountability. How much of that is also the problem? So I throw this question to
Yeah, I mean, it's one of the things that's see a major problem here in Ghana. The issue of communication, I must say, yes, the government has done its bit in communicating the numbers, the figures, and all that. But sometimes on the face of it, you want to ask, why is this, that, and that way? For instance, the issue of the peaking. It became a major issue in the country to the extent that, for instance, you're working with strong institutions like Noguchi and KCCI, who were the major lead groups who were doing the testing, and you were talking about peaking. Look, if you say that you're peaking means that you are getting to the highest point of it, and from there, I mean, your worries should start going down. That okay, we are getting to the point where from peaking, the numbers will become very low. But you were telling us that we are peaking. Meanwhile, the numbers consistently rise. As I speak, the numbers have soared from 5,406 that I did see a few hours ago to over 5,500. This is in the speed of 30 minutes. The numbers have gone up. So why do you talk about the peaking? So generally, you are communicating to people, they do not understand it. One other issue also had to do with, Ghana has several languages. When the whole issue started, the major concern to most of the citizens was the fact that everything was done in English. How many people can read, speak, and understand English? Come to their level. But when things became dire, that was where they realized that, no, we need to change the communication strategy. Even the president, I stand to be corrected, but I think about his first 3 or 4 addresses were all in English. It was subsequently that they changed to other languages. So how do you expect my grandmother, who is in the village very, very far away from the capital, who doesn't speak English, to understand you when you are addressing the nation? You even advertise that you want to address the nation, say at 8 p.m., it moves to 9 p.m., it moves to 9:30 p.m., and you finally address the nation at 11 p.m. when the people are asleep. What kind of games do you play with us? So you see, the issue is that the transparency, yes, I must admit that to some extent, the transparency has been there, but to what extent was the transparency? If we are having challenges with this now, you say that you want to, most of the factories and others who you have contracted are doing the face masks, the locally manufactured ones. How do we even afford it? So, look, as long as 2 cities, people cannot afford the face mask. And this is one of the major things you need to do to protect yourself. I went into the village last weekend, spoke to some of the people in the village, and they told me that, you know what, I have only 1 face mask. I have been able to buy that. But because it's the only one I have, that is the one I have to use for the whole week before I wash it. How do you ensure the hygiene with respect to this? So sometimes, yes, what the people are asking for, calling for, is the fact that you should be more transparent, and also you should be leveraging the sort of interventions you're giving the people. So these
Thank
are
you
the
very much.
concerns. Yeah.
Thank you, Komla. Thank you. You speak with great passion and obvious
I'm
love
sorry.
for your country and obvious love for your people.
Mm.
Now I'm going to give Dr. Judy an opportunity to ask a question with follow-up.
Thank you all. You've described very passionately and also clearly the dire situation in your countries, as to use a word that Kamala has used. So given that I'm a psychologist, I would like you all to address in as succinct as way as possible about the mental health that all of the situations that you have described now is having on the people. You're talking about extreme poverty, lack of trust in the government, kids not going to school, people not getting messages clearly. All of these elements create tremendous stress. I've seen it in West Africa because I was there during Ebola. I've seen it in Hong Kong during the SARS outbreak. So I have seen the stress that people undergo with all of these elements that you've described. What is happening in your countries with regard to people's mental health, and what should be happening?
Well, let me see. I'm going to have to do this and run because it's almost press time. I need to go and then work out on other stories. But let me say this one quickly. The issue of psychologists. I will speak for my station. We have, there's a program we call 360, COVID 360, that's shortly after the morning show from 10 a.m. to midday. What we do is to constantly put on psychologists who are able to psych up the minds of the population on what is actually they should be looking out for. If you have a problem, yes, you can call them. They can give you advice. They can take you through the mail as to what to do and what not to do. Also, on the part of the government, I must say that they have made available some psychologists. The Ghana Psychologists Association have made themselves available. They have their phone numbers that they have given out to the public, that if you're in distress, if you're not too comfortable with what is going on with respect to the COVID, you can call them on phone, even if they have to come to you or something. Of course, they will. Now, the issue of stigmatization lately has become a problem. Some of the people who have recovered within the society in which they are, they've been badly stigmatized. And I must say that it's one of the challenges we have as a country here in Ghana. You will find even people who are well educated stigmatizing somebody because the person has been diagnosed of the coronavirus. How do we do that? But you see, many people have also blamed the state for this because from the onset, the approach was to spread calm and not fear. So because of that, many people, for instance, if I should look, in the community in which I am, there was somebody who was meters away from my residence who developed the symptoms and all that and called onto the hotline. And when they were coming, the ambulance came there. The speed and siren and everything with which they came, with even the security men and all that. After that, the whole house was put into self-quarantine. Now, people around largely would no longer go to that house again because they say that that house, if you go there, you will get a coronavirus. How do we deal with a situation like this? So, I mean, the issue of stigma has become a major issue. And that is where the issue of psychologists have had to come in now. They are working tirelessly, at least on my network. We provide them the platform. We talk to them and say that this is what you've got to do. This is what you don't have to do and all that. The government on the one hand is also doing their bit though. So I think that for now, we need to be looking at psychologists. Even students Going back to school, how do you go back to school? One of your students suspected to have gotten the virus. If you go to school, how do you deal with the person? How do you relate with the person? So these are the challenges that I think that as a country we are facing, and all of us, all hands on deck, we're trying to deal with it. Yeah.
Thank you. Wonderful.
Judy,
Yes.
follow up?
Follow up. Yes. So Ralph, what is the
Yes.
status of the mental health of the people in South Africa since given the high rate?
Well, I have to say that we have not really prioritized it very much. I've had some snippets on radio advertising around the stress that relationships might find themselves in, couples and so forth, in a stressful moment like this. And there was an advert on one of the popular English radio station, but I talk on most radio stations. I don't think I'll be giving you a true picture if I tell you that somebody sat down and factored in the mental health aspect. Actually, I worried about it in my column about 3 weeks ago, and some of the comments by people on the column were saying that, thank God, someone is thinking around the mental health issue, because the reality is that I'm beginning feeling it myself. I mean, I work from home generally. I write, that's all I do. I work from home generally. And I'm used to, under normal circumstances, being in my house for about 5 days. But the mere fact that I cannot get out psychologically, when I think about some of the people who are even in the harshest conditions, whom are even struggling to find food, and they cannot come out, and they are living even in the most difficult space that the humankind can actually exist. And my criticism to government here has been very much open. I've been saying that it's not about the amount of boots you put on the ground. It's about how you walk with the people and understanding the repercussion by all means. And humiliating people by setting the security on them is just not helping. It's going to lead to depression and so forth. So, and also the question of gender-based violence as well, it will escalate in moments such as this. I'm glad the president spoke about it last night when he went on in a very, I think, the most honest way, saying men have declared war on women. I think that sensitivity is very much useful, but we must also note as well the mental aspect of it, how much toll this is going to bear upon us. And I've seen people not knowing how to work within, some people are struggling to find out how to manage time working from home. People who are used to going to work 9 to 5, now suddenly they don't know if their bosses are seeing them. They end up putting abnormal 15 hours because they are home. So we all need to be walked through this. All aspects, I think, need to be attended.
Thank you. The challenges are enormous, really, and I'm so glad that you're thinking about it, and as reporters really raising this issue. Cecilia, what about in Nigeria?
Speaking about the mental health in Nigeria, it's even the stay-at-home order itself. For one to stay at home for almost 5 weeks is enough for one to be depressed. But in Nigeria, not like we have in Ghana, that they have where they could call for maybe counseling or for assistance. In Nigeria, we don't have that kind of. For 2 routes, I didn't see any maybe any campaign against or for people to call. But what I observed is that there were some media reports, talking about mental health and what people could do to ease stress or to lessen mental problem during the period. But apart from that, I also saw a message from Catholic doctors, calling people, telling people that they were available for counseling and treatment. So that is from Nigeria.
So basically you're saying there's nothing like what Komla was talking about. No radio shows, no television, and no service. But how are they getting the communication out that they're available? If you could just tell us that, and then we'd be.
Yes, there were some programs on television, radio, telling people what they could do to help themselves, to help build their mental health. But there was there is not structure to also say that even if you are affected, where you could go maybe for counseling and the rest. There is not also provision for that throughout the period, and which I feel is very, very important. Just like we have abroad, whereby issue of mental health is very, very important, whereby if you have any issue, you could call for counseling. But here we don't have that kind of structure whereby, or system whereby people can go for assistance or for support.
I think it's clear that both the health and mental health systems need to be far improved and expanded amongst so many other issues that are going on. Thank you all.
Thank you, Judy. Milton, Black Star News, the publisher of the Black Star News, the Pan-Africanist, the main leading Pan-Africanist in the United States. Go for it.
Thank you. Thank you, Gordon. Thank you to all the journalists who work under very challenging conditions in our beloved African continent, where often the government see journalists as enemies of the people. But that's not only in Africa anymore, as we know, even here in the United States. The president sees journalists as enemy of the people. So first, I have just a general observation that maybe I'm also actually encouraging you journalists to demand this of your governments. When the Ebola epidemic broke out in West Africa, we needed tiny Cuba to come to the rescue. And I think that should be a lesson to us in Africa. We need to put demands on our governments. Why do we not prioritize healthcare spending? All these governments boast of their fantastic military and the weapons, and they have these big parades showing off the weapons. I don't see any of them showing off the hospitals and the latest medical equipment in the hospital. But I have a question for Brother Komla. Are there any lessons that Ghana can share with the rest of Africa? Because I see that the last numbers I saw, and you said they've gone up. The last time I saw it was 5,408 cases and 24 deaths. Obviously, 24, any number beyond 1 is terrible. But 24 compared to in Egypt, where with 10,431 cases, we have 556. I think maybe there's some lessons that other African countries can learn from Ghana. So that is my question to Brother Komla. To our sister Cecilia, okay. You spoke about some of the restriction being relaxed. And that is important, given that, for example, Lagos is such a big city. How are people going to survive without having the time to come out to purchase some food? So can you describe how that is being conducted? Are people being allowed to come out at a certain hour to buy food? And how is that working out? And if that is not the case, how is a big city like Lagos being fed by the government during the lockdown? And my question to Ralph, you spoke about the challenges of trying to securitize socioeconomic problems. I wanted to know, is there the beginning of civil organizations coming together to demanding to have a dialogue with the government? Because I know traditionally civil organizations have been very strong in South Africa, and they were critical in the liberation struggle. So now are they coming together and saying, government, we don't want you to be the only one dictating the information and conduct. So you must have a conversation with us. Is that being conducted in South Africa right now? And another question for Ralph. There are very many wealthy people in South Africa. Why should the government take up the responsibility alone to feed the vulnerable parts of the country? Even your own president, he's reputed to be a billionaire, not only in rands, but in US dollars. So why don't we get people like your president and all the other billionaires in South Africa to at least contribute some to this relief fund to help the vulnerable communities? After all, they owe their wealth to the suffering of the masses in South Africa. Okay. Thank you, comrade.
All right. Okay, so I'm going to take mine and then I'll answer quickly.
I would ask you to be as brief as you can, but as thorough as you can.
So briefly, I must say the issue of the debt. I mean, when we're having a prep the other time, we did say that, well, maybe it's a dent of of luck on our side. There isn't much that we're doing because we know that we don't have any vaccine or anything. But from the understanding we get, most of these people have underlying health conditions like diabetes, hypertension, and then the like. That is one of the things that has affected them so much. But one thing that I must say is that because the government does or did go ahead of the virus by doing mass the testing and then contact tracing, they were able to get on top of it to a very large extent. So you may not have symptoms or the signs of it, but because of the contact tracing, they were able to identify and self-isolate this people, and then they give them the support that they need to give them. I mean, taking on vitamin C, eating good food, living in a good environment, your hygiene, everything is okay. So that's one thing that I think that they've been able to do. There isn't any magic, so to speak, that they did. It's one of the questions we have asked so far. But let me also help Ralph by saying that, yes, it's true. The question of Cyril Ramaphosa going all out and other wealthy people going out to help them. But yes, that is key. Myself, I mean, during the lockdown, the little that I have in terms of my salary, I divide it. I mean, I'm able to get food for about 10 or 20 people in a week. This is little, but it counts a lot. Other people shouldn't just be the burden of the government. I mean, they're stressed. We all know we are not in normal times, so we should all take things on board and help. Yeah.
Thank you, Komla.
Okay, next question. Next answer.
Okay, let me start with how I think other, civil society organizations are actually fighting back, I would say. I mean, the reality is that government has got no choice here. They went full steam and they got themselves into trouble. They could not manage the queues out there, the lines for food and so forth, because NGOs have always been the eye and the ears of government when it comes to implementation of services. Even if we know there is always a confrontation between government and the NGOs, it all works out to people getting the services. I mean, a good example here is the world's biggest anti-HIV program, which is rolled out here in South Africa. It was won through a court litigation involving an NGO. So you really need to bring them back. So there are legal cases that are underway. There is an advocate of the Bar Council of Johannesburg, very senior council lawyers, who actually asked a question about the constitutionality of the Command Council exercising such extensive rights. And we also have, on the other hand, a case of an inquest into allegations of murder in the hands of the police during this, where the judge is actually being pushed to look into the operation of the police. So other NGOs are even saying to government as well that, look, government, you cannot tell us to bring the food deposits to you so that you can redistribute to the people through your own networks, because the controversy is that some of the councillors that are distributing this food are corrupt and they end up not food going to the rightful people. So that is the leg upon which people are standing. But also, again, the business lobby is being very insidious here, if we could say. I mean, the tobacco lobby want to sell some cigarettes, and they're saying to government that, but you have been unreasonable in many other areas, including banning smoking. So government is under pressure. There will be various lobbyists. And I think that even when a tobacco company goes and asks government to be reasonable, I'm a Democrat to a point where I believe that someone who has got a legitimate case to make will see that and might follow through and say, oh, what about my case about being unreasonable on closing on this issue that has got social impact? So I'm of the view that let us have this floodgate of cases coming out, because if we don't have them, if we don't have an imminent threat of this Command Council in South Africa being declared unconstitutional, it will never work with the people. So there is the only way to push it towards a compromise, and I think it's getting there. President Ramaphosa spoke a lot about consultation last night. About the billions, I don't know. I don't have billions, so probably I'm not even allowed to be part of the conversation that starts with a B. But be that as it may, I think you are raising a very fundamental issue. South Africa actually has been named as one of the top countries that give a lot in the world. The gift of the givers are from here. People do volunteer in small terms as well. There are those who politically are raising the question that says that those who are super rich should actually feel a moral obligation to give to the poor. You cannot legislate a moral obligation.
Exactly.
So it comes from the hearts of the people. Those who have money to give, it is their own billions. And for me, I don't think I'll stop greeting someone just because they didn't give their billions. I'm also a Democrat. It's their own right. But ordinary people in South Africa are giving through Solidarity Fund. They're giving small money. Some of the billionaires have actually made about R1 billion here, about maybe $500 million or so, into loans for small and medium enterprises. So within our conflict as to who stole from who in the past and everything, we end up getting to a point where somebody goes into their pocket and the society gets better amidst our conflict. So I would say that even if we have these billionaires, I don't think we're a giving nation. And those billionaires, I think they're also not enjoying it so much. I mean, the president is the one who pushed cabinet to want them to take a salary cut. He can afford it, but I'm just happy that there is a president who's saying that cabinet members are overpaid anyway. So it's quite, I think we're on the right track.
Okay. And Cecilia, I think you had a question too?
Yes, from Dr. Milton. Yes, talking about relaxing lockdown in Lagos.
Yes.
Lagos is the epicenter of COVID-19 in Nigeria. And it's really a big problem. With relaxing the lockdown, it means that people can go out, there's restriction of movement. People can go out 3 times in a week. For those that are civil servants, they go to office on Mondays, Wednesdays, and Fridays from hours of 8 a.m. to 2 a.m. And for markets, they go 2 times in a week, Wednesdays and Saturdays. And, you know, Lagos being the epicenter, it's even a source of worry that the very first time, that was on the 4th of May, that the lockdown was eased. You need to see the crowd that came out. The crowd became a source of worry to say, after 14 days, what do we expect again? So now the state governor is threatening that if people don't practice physical social distancing, or where you see people wearing face masks, some will not even wear very well, some will do all sorts of things, that if they don't, you know, follow physical social distances, that there might be a lockdown again, that it might be forced to place another lockdown again. So we are waiting for the result of what we have seen so far, but it's really a source of worry to us because of the crowd, because of the way to manage crowd. In Abuja here it's easier, but in Lagos it's far difficult to manage, you know, the kind of crowd being the largest city and it's densely populated.
Thank you very much. Thank you very much, Cecilia. I think we have gotten through this segment. We've had long answers, so we're not able to go around again. But we do have some questions from the participants. And one of our colleagues, Mohammed Marda, who is the deputy at the United African Congress and member of the African Advisory Council in the Bronx. He will be posing the questions that have come in from participants. Mohammed. Unmute.
Unmute.
Unmute Marda. Mohammed Marda. Yes.
Yes. Okay. Thank you, Chairman, President Gordon. I was going to make the same mistake you made earlier by calling you Chairman. Thank you, President Gordon and Chairman Dr. Nurusin and everyone, Milton, Dr. Judy, and our wonderful panelists. As Gordon said, my name is Mohammed Marda, and you know, I'm a Ghanaian, so I'm happy to see Komla. I'm happy to see Komla. Komla, hi.
Hi, Mohammed, hi.
Yeah, and to get the real facts of what is going on the ground in Ghana. So I know, Komla, you mentioned earlier that you have to run because you have to, get on, prepare for your newscast.
Yeah.
So let me just go quickly to some of the questions for you since you have to go. So there's a couple of questions. So I'm just going to pose all the questions to you so that you can answer, and then you feel comfortable when you have to go.
Okay.
Then you can leave. So the first question was, is there a chance that the government is undercounting the figures that they are reporting, right? So you mentioned 5,000 and something and only 20 something deaths. Is there a chance that the government is not reporting actual numbers? So that's one. The second question is, which sectors of the economy and aspects of society have been most affected and that may need special attention in restarting the economy? Another question that came up, there was a fundraising by government to support in the COVID-19 initiatives. Do you have an idea of how much was raised and what the monies were used for? And okay, so I'm just going to leave these three because everything seems to be along the same lines.
Okay. All right. Okay. So I'm going to take the first one. That's whether government has been undercutting the figures. Now, when we had a backlog of cases or samples that were yet to be tested by Noguchi and KCCI, but I must be quick to add that we have had about 15 more, I think in total we have about 23 institutions that are doing the testing now. When it was just KCCI and then Noguchi, that was the perception in the minds of people. For instance, let me state an issue. There was one of the times that the Ghana Health Service did report, and the website did report on a figure that's 1,062 or so thereabout. And just moments after that, the figure disappeared on the website. then the government there were suggestions that these were machinations from the opposition and people who were not friendly to the government here and there. Then a week or two after that incident, then we recorded that same figure on the website. So the former Director General of the Ghana Health Service, Professor Jiman Bedu-Akosa, did indicate that something was wrong somewhere, that the figure disappears on the website and they state that is not the figure. Then a week after, the same figure comes back onto the website. What are you trying to communicate? So there was a hula baloo about it here and there. That was the perception or the suggestion from people when we had the backlog. As I speak about the third address that we had as a country, there hasn't been any backlog. Now they are testing real time. So from what we gather, in fact, one of the things I must say that we lack, for instance, as media in the country is the fact that we are not able to put to test some of these things because we don't have the capacity to do it as media houses. So we take what the Ghana Health Service or the experts do say to us, that we do not have the figures they are giving us are the real-time ones and we have to go by it. But now they are not even recording it on a daily basis. They come up to tell us that these are the figures we have recorded, say on a Tuesday, then on a Thursday they come again to give an update and all that. But what we are wishing is that they'll be doing it periodically, real time, every moment. If you have the virus now, and then the confirmation is done and erase up the scale real time. Let me go to the issue of, excuse me, which sectors of the economy has been affected. Revenue, I must say, revenue generation in the country has been dipped badly. Just yesterday, the Ghana Revenue Authority had issued a statement where the government, prior to the COVID-19, had given a benchmark when it comes to the clearing of goods at the port. Now that benchmark has been withdrawn, that now when you go to the port, you're going to have to pay 100% duties. So it should tell you that largely the issue of revenue, people are not paying taxes because some people are not in business as we speak. I mean, there are most restaurants, hotels, I must say, hotels have been badly hit. I shudder to say that about between 70 to 85% of hotels in the country are not working. Most of the large hotels, the Golden Tulip, the Kempinski, and up they are not working at all. So it should tell you, revenue government is not making. And apart from this, the informal sector, that is also been affected very badly. The COVID fund, well, we don't know how much has been put in there. There was a seed money. Several donations were made. In fact, we asked about accountability, which is one of the things that the anti-corruption people have also asked as well, that we should know real time how much is in there. But the government does make a case that, well, after all of this is said and done, they'll come to Parliament. That is where you have to account for the people. So they'll come to Parliament, the Minister of Finance will come to Parliament and come and account. Beyond this, they themselves, the COVID fund, are doing donations here and there to the Ghanese hospital and other institutions here and there. But, well, the donations continue to come in handy to the fund, I must say.
My friend Mohammed.
Yes, sir.
We have a surprise guest here.
I just saw that.
I'm going to give him a few minutes to say something.
Yes.
He is the dynamo from Sierra Leone. His Excellency Ambassador Ambassador of Sierra Leone to the United States. And as I mentioned earlier, I don't know if he reprimanded or he corrected me or he advised me or what, but we have him here and we'll let him have a minute or so to say something.
Well, Gordon, I think you also need to let everyone on the call or the webinar know that he was a founder and president of the United African Congress in another life before he became ambassador.
Absolutely.
So I think that's important. I think that's important for us to know that.
That is why I was afraid to say I was president and fill his shoes.
Welcome, Your Excellency.
Thank you. Thank you so much. Can you hear me all?
Yes, we can. Yes, we can.
Well, let me take this opportunity to thank Mr. Gordon Tapper, Brother Mohammed Mada, the entire team from the United African Congress and the participating partners in this for really bringing our brothers and sisters on the continent into this conversation and this body politics, particularly when it comes to COVID. I just got off about 30 minutes ago on a conversation, similar conversation with the White House here in the United States. And I can reassure you that the discussions that you are having are now global. And I should say that Dr. Judy should be glad to knowing that her terminology of physical distancing is now something that is going around the globe. So please get a lawyer so that you could put that in reservation so that you will get credit for it. So everybody's using that. I should really say this, that the efforts that Gordon Tapper and the rest of the partners have done is not only discussing the impact of this epidemic, particularly as affects our continent of Africa, but they are also talking very specifically of what do we do as a community. That is really what I see that is quite different from all of the people that I'm talking about around the world. You know, government has a role, but so does civil society. And the little that we could all do together is what is going to make the difference. let us don't think that the West is going to enthusiastic or magically going to do for Africa. Africans have to start thinking that we got to do for ourselves what we can to fight in this epidemic. If anybody else helps us, thank God, because they too are facing the similar epidemic here, and the challenges are real. And when I talk about my adopted home, New York City, what is happening there, every time I open, the news is not very encouraging. But I really want to say to my brothers and sisters on the continent, don't wait till there is an epidemic of this nature to start connecting with your global diaspora constituencies. Brother Mada was very kind in stating some of these things, but these are the people who are the voices, who are putting the African agenda on the world stage. So that collaboration and cooperation is very, very necessary. And finally, my final point is, Mr. Gordon Tapa is from the Caribbean. He is Caribbean from Jamaica. So if you can see, and you can see someone who is passionate about the continent, and also people like Dr. Judith Koreansky, all of these people, they were not born in Africa, but they have a passion for Africa. So if they're joining hands with us, I think it is something that we should all be grateful and thankful for. So again, thank you for what you're doing. I know you have some other thoughts, but I'm not going to say it. I'll leave it to the president and the chairman and the vice president. But I would really like to say that as a diplomat now, I am going to continue to advocate, to encourage my colleagues in the diplomatic community to see the diaspora as partners, not enemies. I thank you, Mr. Chairman, and I yield back.
I am the chairman of this gathering here. I'm the president of the next African Congress. Thank you very much. I actually like the term that I just coined, the dynamo from Sierra Leone. Thank you very much, Ambassador White. Thank you.
Okay.
Mohammed, you can continue with the questions I've gotten from the public, but again, keep them brief and keep the responses brief, because we're yet to hear from Stephanie with her wrap-up and the presentation.
Right.
Thank you all.
Okay. So I guess the same question goes to the other two, Ralph and Cecilia, about which sectors of the economy have been affected the most, and what do you think we may need to do to restart, our economies when we go, across the finish line of this pandemic?
In South Africa, the sector that I think has been affected the most, it is actually the hotel, restaurant, and the hospitality. And remember, this is a sector that tends to absorb a lot of young people, some of whom do not have that advanced education. So you could say it is a very labor absorbing sector. And I think it is the one that has been very much affected. And you're asking, what do we need to do when we reopen the economy going forward? I mean, I've traveled across the continent. I've been to Ethiopia, I've been to Chad, I've been across the continent. One thing that I think African economies are missing out is not actually to maximize on their informal economy sector. I mean, when I go around, you find out that on the African continent, you find out that the economy is very informal. A lot of people earn a livelihood in the informal sector of the economy. You don't have to formalize it. You just have to know more about it. Start getting more intelligence about how many people are in the informal sector. I mean, I read widely, you find out that the informal hair sector economy, where young women are braiding hairs to make a living, is worth billions on the African continent. We're just speculating, but if we start getting data, reliable information on the informal sectors of our economy, we will then know how to help people, because it is currently the most labor absorbing, where people are earning a livelihood. And this restaurant and so forth, people cooking on the side of the street. It's the bigger part of this informal economy. And actually in our country, it is very much connected with the formal economy as well. So I would say that I will urge economists on the African continent to go back the very same way in which they know how to price bonds, how to price equity, how to do all these things. They need to do research on getting us to understand the informal economy on the African continent. It is too big for us to have it as a footnote in this way. And I think when we go back, we need to focus on that, because that's where majority of the people are. Let us bring some of the dynamics of the informal economy into the mainstream discussion. Let us see if we can have policies that allow more entrepreneurship at an informal economy sector without necessarily trying to formalize the informal economy. I think we need to do more work and gather more intelligence. For me, I know that other companies, they will survive. Other companies, they will come back. The financial sector will come back. Others are so well formalized that they are a good lobby on their own. But no one lobbies for the informal economy. It's everybody for themselves, but it's a huge sector. I think we need to focus on that when we go back. For me, if you do that, any other thing I can live with.
Wonderful. Thank you. Cecilia?
Okay, thank you. Mohammed, one more question from you.
Sure.
I think we have as many as 22 questions
Cecilia
that have
didn't
been posed. Unfortunately, we'll have to apologize to you all, to everyone out there. We're not able to get to them. I think we select randomly the question to ask, and I will ask Mohammed to pose one more question.
Right. So I guess the same question goes to Cecilia. Which part of the economy, the Nigerian economy, has been affected the most, and what can we do? Another question, and if you can answer that just briefly. You mentioned 25 laboratories that's doing testing in Nigeria, and you have 36 states. So how is that being managed? So, I mean, as brief as you can. Thank you, Chairman Gordon.
Thank you, Mohammed.
Yeah, thank you very much. The area that's been that COVID-19 has impacted heavily is the revenue of the country. Nigeria depends, on oil for the source of earning, and now that the price has fallen, you know what it means? That is all of the economy that has been affected. So also the education sector. Before now, the ASU was on strike. So COVID-19 also made the education sector, also what happened now has also made the education center to also, be a sector that should also be focused on. It's not only education, hospitality sector too has also been affected. Hotels, everybody abandoned. Almost aviation too has been affected. So what I feel can be done now is that experts have advised that Nigeria should diversify its economic long time. But I think this is the time for us to look inward now and see how can we diversify our economy from solely depending on oil to other sectors, so that we'll be able to provide for the citizens. And also, I also see that technology is going to also, in years to come, technology is going to also be a tool to also, also rule, even the economy rule everywhere. So it's also good for the government to also invest in science and technology, and also see that it's a source of worry that Nigeria will go to other African countries to source for herbal remedy for cure to COVID-19. I think this is the time for us to go. We're not like this before. Nigerian people used to come to Nigeria for medical tourism in those days. So now I think we should go back to where we were before. So that even we should look inward. Yeah, we have local heads. That even who knows, even if you have what we are looking for in Madagascar, even if it's there in Nigeria. So we have to look inward and see how we can also, see what we can do for ourselves. That we depend so much, on others. So I think it's the time for us. COVID-19 has made it has taught us a big lesson for us to look inward and see what we can do so that we too, people can also go to come to Nigeria for solution.
All right.
Okay.
Thank you very much. Thank you. Back to you, Chairman Gordon, then.
Thank you, Mohammed. Well, I really want to thank everyone. We've had a very lively discussion. We've had very informative, very interesting presentations by the journalists who have enhanced their reputation as fearless fighters in their country. And we've been very fortunate to have them here with us. And also the panelists, I believe, have asked very good probing questions. Even though I gave them one question to ask, they found a way, led by Milton, of asking 3 or 4 questions in one. So very good strategy. Anyway, thank you all. I want to turn over to Stephanie Evans. She is the Director of Education at the Harlem Hospital. She is Director of the Give Them a Hand Foundation, and she will do a wrap-up of where we are. And she has some slides that she wants to show as well. And Stephanie, it's yours.
Okay, Gordon. I think I wasn't going to send the slides, but here goes. I wanted to thank Ralph, as well Cecilia and Komla. As journalists from Nigeria, Lesotho, South Africa, and Ghana, they have related how the coronavirus has been impacting and continue to impact their respective countries. What is clear is that in addition to the health and well-being of individuals, there's a strong socioeconomic impact which we cannot ignore or treat lightly. We know that the lockdown has increased unemployment in most parts of Africa. This, in conjunction with the reality that families are unable to receive support from relatives abroad, in some areas through digital transmission, all of these convergences push vulnerable populations into more precarious situations and perhaps into illegal economies. The impact has been restriction on mobilities, closure of borders, sometimes loss of labor due to illness or death, food security issues, nutrition, and impact on the livelihoods of individuals. The COVID-19 travel restrictions have compromised the transportation movement of supplies, and as Cecilia and others have reported on open air markets, this may result in increased prices in some countries. Movement being restricted also affect farmers as the planting season approaches. All these factors can lead to food insecurity, leaving millions at risk as the pandemic expands. In addition, they talked about children not attending school. There's no school, that means there's no in-school meal distribution. 18 million children are supported by government-led feeding programs and are affected in Africa. And in addition, 2.2 million children are fed by international programs, and they are also affected. As we all know, meals for children fulfill some of their daily nutritional needs, and the health effects contribute to their growth and development and immunity. So food insecurity will place communities at high health risks. As talked about by Ralph, poor management of the lockdown has in instance increased the heavy-handedness by some security forces in some countries. Some of the challenges caused by the pandemic can lead to more violence and challenges to areas that are already in conflict. So what can we do moving forward? We need to address the needs of most vulnerable populations, children, migrants, women, the disabled, to mention a few. There's a need for services to provide remote psychological services and mobile shelters for children, and I'm sure Dr. Judy would agree on that. The humanitarian needs will also increase, including healthcare needs, ongoing needs, and new needs for food and economic assistance. Komla also talked about testing. We also need to measure the control of COVID-19 through testing and identification of cases so we can have an accurate number. And in moving forward also, we need to appeal to the international community for global aid for food and other resources. We also need to think about preventing the malnutrition of the millions of children under 5 years old. And we need to provide more food distribution sites for children and families. We also need to address the needs of millions of displaced populations. There are approximately 5.6 million displaced people in Africa due to conflict and other issues. 1.3 million are refugees, and 1.6 million are stateless, according to UNHCR. Also, moving forward, we need to protect children living in orphanages, refugee camps, and other social care centers. The question also brought up is how, I think we mentioned this briefly in our Q&A, how do we address the problem of some groups controlling resources while making other groups vulnerable? Again, with a lockdown, in the home, children are at greater risk of experiencing violence, other forms of exploitation, and challenges to their mental health. So we need to develop more programs to address these issues. As we've all said, we need to enhance the healthcare infrastructure and capacity, provide more PPEs, digital support for education, information sharing, money transfer, and other things. We also have to use our traditional resources like storytellers and troubadours in educating our rural communities and increasing awareness posters in communities on COVID-19 about transmission and community spread. Today, we have kept the spotlight on these issues and we have amplified the conversation. And as we move forward, we need to act for Africa. Thank you, Gordon.
Thank you very much, Stephanie. There is something I want to do. We have been speaking with the Billy Ntorote from Lesotho. And the reason why we specifically wanted someone from Lesotho is because they had, the country had claimed not to have had any infections. Until yesterday, they had the first infection. Billy has had some technical difficulties, and we do have a video clip that before we go, I think is fair for us to show some of what we have done with Billy and some of what he has said. I think many of you will know that Lesotho is a very unique country. I don't know of another country that is completely surrounded by a country. And Lesotho is in the middle of South Africa. And people cross from South Africa into workers in Lesotho, go into South Africa to work and come back. It's like seasonal. But I think we should hear a clip from Billy. Can we do that? Oh, that's me. Audio.
Mm-hmm.
Audio, could we turn up the audio? We have no audio. Maura, can we do something with the audio? Okay, it appears that we've made a gallant effort, but it doesn't seem we'll be able to get this done today. So again, I want to thank all of you listeners and viewers out there. I know you're from all over. I got a call this morning from Nepal, from someone who wants to be on and wanted to know exactly what the time was in Nepal's time. Again, from Argentina, from India, there was someone who wrote and asked, what are the similarities between India and Africa? We have not had the opportunity to ask the question, but I think we will simply have to bring this to a close, and perhaps we will tackle that in our next webinar. In fact, it might be more appropriate for our next webinar. For one of our next objectives is to discuss the financial condition and how rebuilding will be accomplished. And I know that we have already made contact with people from the World Bank and others who we will be having. I think at that point it will be a very valid comparison between Africa and India. I think the population of both countries, both the country of India and the continent of Africa, are not very different, 1.3 billion thereabouts. So I want to thank all those who work behind the scenes. Maura, in particular, she did all the technical work, and our colleagues here, Milton, Dr. Judy, Dr. Nurisen, Mohammed, Stephanie, were the ones who put it together. So give yourselves a big thank you and a big hand. Thank you all. And our next webinar, you will be notified of our next webinar in the next few days. Thank you all for joining us. Anyone? All righty. Well, we still have 130 people on at this point. So Dr. Judy, say goodbye. Dr. Nurisen, say goodbye. Stephanie, say goodbye. You're all muted.
Yeah.
You're all muted. Unmute.
It needs to be done by Maura.
Okay.
So
Yeah.
I want to acknowledge not just
Yes.
the speakers who've been so amazing, the journalists who are so courageous, and all our team, but those of you on the chat who have mentioned such important and interesting things, the work that you're doing in Cameroon, the studies that you're doing, the questions about the traditional medications that have been used and suggested, like everyone's talking about that from Madagascar, all the interesting work that you're doing. So I did put up the Bridges Across Boundaries Gmail, and so I think that would be a good way for everyone to be able to collect together and be able to start making a network so that we can share all these thoughts.
Very good, Judy. Dr. Nurisen.
Yeah, I'll echo the sentiments that Dr. Judy just said. I think something that, was it Ralph or maybe Komla, who said something about communication. We think because we are in Africa, we can communicate in the same language. There are, vast majority of people have their own, it's a culturally, linguistically diverse continent. And within the same country, there are so many languages and dialects. Then the issue of cultural competency becomes important. You have to be able to communicate with people in a relevant manner in order to reach the people, and also to be able to deliver service accordingly. Without that, that was I was really struck by what he said, that they communicate. They are sending this information in English to Ghanaians. So therein lies one of the big problems. But with that said, I think I thank everyone that tuned in and joined us today. The fact that many of you signed up to this shows that it's a topic that is on many of your minds. And I'm glad we were able to at least, put this together. And I thank the journalists who are knowledgeable, very articulate, and passionate about, as has been said already. And so hundreds of questions that came through the chat, I can follow that. Very, very important questions, some of which were answered. but quite a number of questions have remained, unable to answer them now. But in the future, in the coming another couple of weeks, we are going to hold another seminar, a webinar. And this will be an ongoing process for us addressing the issue of COVID-19 in Africa, with dealing with various aspects of how it impacts the continent. So tune in, keep your eyes on the announcements, and hope to see you again. Thank you for joining.
Is Cecilia there? Or she left us?
It looks like she left.
Oh, I think Cecilia is gone. I wanted to take the opportunity to ask her what really is taking place in the slums. And I'm not saying this, asking this question disparagingly. It is known that Lagos has some of the biggest slums in the world, perhaps outside of India. There is a floating city on water, which they call the Venice of the slums. Over 300,000 people who live there underwater. And I wanted to find out from her how, what is put in place to handle communities like that. We have a situation where the infection in Africa has been so much less than in the United States, in most other regions. And we know that Africa has perhaps one of the worst possible, the continent of medical infrastructure to deal with this. And we know that physical separation is really not even possible for large segments of the population, yet the numbers are kept down. They are escalating, they're moving up, but they're kept down. And it is a mystery to me how that is happening. Maybe Komla.
Well, actually, you have people on the chat who are saying that they work there in Makoko, and who would certainly know about it. So this is the perfect way to follow up with communication through the Bridges Across Borders.
Well, I do hope they will get in touch with us, communicate with us, for it is something that we really should explore, because it is like a time bomb dropped into a space but doesn't go off, or goes off like a firecracker. And we should be exploring that. We should be looking into that. And if you notice, the number of people who are on at this point has increased, when normally it goes down towards the end. I'm not calling what the number is, but it has continually gone up from a midpoint where it had gotten down. But it is quite unique. Stephanie, any comments? Any closing comments?
I think that we had a good perspective from all the countries. I noticed someone in the chat mentioning we should have had Cameroon and Morocco. So please email us, and we'll definitely take the information, and as we're planning, we'll look into that. That was mentioned in the chat that we needed someone from Morocco and Cameroon. And then I think there was someone else who said that they were hoping to, we should take some lessons from Senegal. So we'll take a look at that as well. But I think the journalists were exceptional and did a great job.
Right. Well, there are 54 countries in Africa, and they all have journalists, and they all have a story. So I think we can be reaching out to other journalists in other countries to give a report. And what I believe is that we're getting a much more accurate report of the situation and a feel for what is taking place when we're getting it from journalists and not getting it from the official mouthpiece or the official reports from the government. So I think it is time that we really call this a day. And thank you all for getting on. And we will be notifying you within the week as to our next webinar. And you all make it very interesting, just to know that there is interest out there and you want to know what we have to say. Thank you all, and goodbye.
Goodbye.